Yo le llego y normal, me miran raro, pero a nada yo le paro. Yo sé cuánto valgo.
Hello, everyone. This is Dan with Deportivo Juventud. We're back for episode 3 of the Tiempo Verde podcast. I'm joined with our usual guests, Rudy and Ricardo. And our guest today is going to be Dr. Parsa Karimi. He holds a doctorate in physical therapy with 20 years of experience in the field. He owned and been the clinical director of our sponsor, PKL Physical Therapy, as you can see on the front of the jerseys. And he owns the offices in Bethpage and Amityville, Long Island since 2004. So, Dr. Parsa, we're really happy to have you on here. How's everything going?
Good, guys. How are you?
Good, thank you.
Everything's good.
Happy to have you on here.
Thank you.
So, as I said, Dr. Parsa Karimi specializes in physical therapy and owns 2 offices. So, Parsa, would you like to explain a little bit about what you do and your offices?
Sure. Yeah, I graduated in 04 from PT school. Actually, 03, started the business in 04. We started out doing mostly home care. And within about 6 months, we had an office in a gym. Then we finally got an office in Amityville. A couple years after that, we opened up in Bethpage. So we've been doing outpatient orthopedic and sports rehab. We handle everything pretty much from your toe up to your jaw. If you're coming with, TMJ pain, headaches, anything like that. So we handle it all. It runs a gamut, a lot of patients after surgery, athletes, senior citizens, middle-aged people. So whatever is limiting people in terms of function and pain, they come to us and we get them, fixed up as fast as possible, get them back out there doing what they want to do.
Right. That's really great. And so if you guys are interested in learning more, we definitely recommend following them. They're on Instagram. It's right in our bio. It'll be PKL Physical Therapy. And if you do go on there, you'll see, and I want to get into the first question right away for you, is Dr. Parsa actually goes into a lot about athletes, professional athletes, who their training staff, who are supposed to be the best of the best, actually not doing maybe exactly what it is. And I have here a question that I actually wrote for you to ask you. It was, so you've done many videos on YouTube and on your Instagram, like I said, about professional athletes, their injuries, and how the rehab teams actually, and I put in quotes here, as you said, drop the ball. They fail to appropriately help these athletes. So can you elaborate as to where the rehab market is going and what really went wrong with some cases of these athletes?
Well, yeah, so I've tried for years to try to reach out to teams and say, hey, listen, I can help your athletes out. They're hurting. I mean, I could watch from TV and just from my couch and just watch and hear an athlete describe the pain they're having. And it sounds like the same kind of pains my patients have here, and it's usually a muscular issue. And next thing you know, they're going into the operating room. I mean, whether it's baseball, football, tennis, golf, soccer, it doesn't really matter. Everybody's having the same kind of symptoms that usually is a muscular issue. And then these athletes who, we all go to work, and if we have an issue with our shoulder or something, fine, we may, be out of work for a little bit and then we go back, because our work is usually not solely reliant on our bodies. Now, these athletes are. And comes around time for contract negotiations, and it's their livelihood. A lot of these guys are in their 20s, early 20s, mid-20s, and they're cut. Years ago, I trained a New York Jet who I was watching the Hard Knock show, and he was 22 years old, and you have the orthopedist from, HSS saying, oh, he's got bad knees. Now, I'm 42 almost. I don't even have bad knees. How a 22-year-old has it, I mean, it's beyond me. So
right.
I reached out to him actually on Facebook, and he contacted me. He came in, and within 8 sessions, he's running, jumping, sprinting, cutting, with no problem whatsoever. So it turned out to just be a quadricep issue, and it was misdiagnosed. They have these guys, riding a bicycle and just doing sit-ups on the side, and there's nobody there to actually evaluate them. Right now, I'm treating actually a New York Giant who last year suffered a concussion and a neck injury. And they were putting a hot pack on his neck for all these months, not really doing anything for him. And finally says, what are we doing with my neck here? And the guy goes, oh, I didn't know you had neck pain. So it just boggles my mind how you pay these guys millions and then you don't even take care of them to get them actually playing for you. It's a horrible business model because it just doesn't work for you. You're paying somebody to play and they're just not playing. And then the care we would all imagine would be the best of the best, right? I mean, how many guys do you know that say like, oh, I got my surgery done by this doctor. He works on the Giants. And you think, oh, they must be great. But maybe the doctors are great. And there's no doubt really, like they really do have the best doctors because it's HSS, it's NYU Langone that are taking care of these guys. But it shouldn't be the doctors that are fixing them. It should be the physical therapists. And those group of people, they are the ones dropping the ball. And that's why these guys are getting cut, getting their seasons cut short, getting their careers cut short, and it's not really their fault, So that's why I really go after the rehab specialist, and prove me wrong, and just tell me that, and prove to me that you're going to do a better job than what I've done for these guys. I've had 2 players, and within 5-6 sessions, they're like 90% better. I don't know what I'm doing that these guys aren't doing, but they're obviously not doing
Right.
something.
Yeah.
No, it's definitely true. And I mean, you see it, you can go like month by month, the amount of surgeries that are happening now. So it's pretty obvious what you're saying. And I mean, as soccer players ourselves, we've all been through injuries. Thankfully, I never had a big surgery, but I 100% agree with you that these surgeries are really impacting the players, and they may not be necessary.
Right,
And,
and it comes back to also musculoskeletal balance, and that's how you can really fix it, and you can easily see what the deficiencies are in an athlete's musculoskeletal system. And say, okay, this is the weak link, and if this is not doing what it needs to be doing, and this is weak, then you're going to have a higher risk of straining or tearing something else. So let's fix it now before it's a problem in the future.
absolutely.
Absolutely. So I wanted to ask you a question going off of musculoskeletal balance. So you mentioned that having musculoskeletal balance is the key for athletes in all sports and levels to drastically reduce the risk of injuries while improving performance during play. Can you explain that?
Yeah. So basically, if you get into the science of it, muscle tissue creates its most amount of force when it's in its best length tension relationship. Meaning, if you look under a microscope, you see the cross bridges of the muscles. As every time it contracts, it's doing what it is, like a ratchet system. If anytime muscle tissue is too shortened or it's too lengthened, it's in a not an optimal position to create force for you, and it has a higher risk of straining. So when you put that muscle in a good length tension relationship, meaning it's in a good position where it's not too lengthened, not too shortened, then it can create maximal force for you. At the same time, your risk of straining that muscle goes down. So your risk of injury goes down, and your performance goes up, because when that muscle is in its best position to create force, you're obviously going to be your strongest, your fastest, and that equates to better performance on the field. So
Right.
you kill 2 big birds with one stone by reducing the risk of injury and getting better on the field. So it's all just figuring out, okay, this muscle's too lengthened, let's tighten it up. This muscle's too tight, let's stretch it out. Why is it too tight? Maybe it's inflamed. There's adhesions built up in the muscle tissue making it tight. Let's loosen it up with some deep tissue massage. And then let's use exercise to our advantage to either shut a muscle off that we want to calm down, or activate a muscle and get it tighter, the ones that we want to create more stability for that muscle. So it's not that hard. It's just not being done.
Mm.
So, yeah. So I wanted to ask, isn't the method of evaluating and treating patients, whether senior citizens or on the other side of a professional athlete like an MLS player, is this all taught in a PT school?
Well, the PT school I went to, it wasn't. And the PT schools that I bring in a lot of, I'm a clinical instructor for 3-4 different physical therapy schools in the area. Toro, I used to do it for Stony Brook, NYIT. The students that come in, when I start talking about my way of treating, they all tell me the same thing. They say, I learned more in 2 days here than I learned in the whole, couple of semesters at school. And it's sad because they're paying a lot of money to go to school, and I'm teaching them a different way to look at it. And they all say that, they give us all these tools and how to evaluate, but they don't tell us how to put it together. And that's what I think is going on. It's not all of a sudden that you're out for a few years and now you get a job working for one of these pro athletes, professional teams, that all of a sudden you become enlightened and you know what to do. You're going to just bring that method of thinking into the pros, and who suffers is the professional athlete, where the stakes are at its highest. Like I said, you and I strain a muscle, fine. Maybe we give up soccer or football or whatever. We don't like it, but at least we can go to work and still make money for our families. These guys, this is all they have.
Yeah.
So I know in my PT school, they weren't really stressing really how to evaluate somebody, how to treat. And a lot of it was more, what does the x-ray say? What does the MRI say? And what does the doctor say? Now, doctors, hey, above my pay grade, I'm never going to pretend to be a doctor, but I think in all of their med school, they take one class in physical therapy. So how are you going to try to figure out what's going on musculoskeletal wise with someone where we have to go to school for 6-7 years for it? They're going to take one class. It just doesn't make any sense.
Right.
And to follow a doctor's prescription is good. I mean, when somebody has surgery, or if there's a torn muscle or a tendon and they reattached it in their specific protocols. But other than that, a therapist should be able to take care of a patient when they come in without the need of anything, an x-ray or an MRI or anything. And, that's what's missing in schools right now. So if they added that, how to put it all together, that would be huge for the field and so much better for all patients and athletes out there.
Right.
Dan, you got a question?
Yeah, Ricardo.
Oh, all right. So Dr. Parsa, so we've all been deprived of going to the gym and joining the conventional team training regimen since March, since the whole pandemic went down and everything's been canceled. What concerns do you have regarding athletes and injury rates, specifically to soccer?
Well, I think in soccer, anything that's like where you're about running, and I mean, even golf. I mean, you when you're not training the way you're supposed to, soccer. I know there's a lot of specific drills you guys do, but also it goes to just going back to that muscle balance. When you're not in a gym and you're not working out, you're not keeping your muscles nice and tight. I know myself, if I don't go to the gym for a few weeks, I start to have aches and pains that I didn't have before. Muscles are a little bit more likely to be strained and bother me, and that equates to joint pain. And the moment you go back to the gym after like a week or so, it's gone. So I'm concerned about the fact that someone's going to try to go back into playing soccer without having their muscles primed and ready and toned. And when you work out a muscle, the tendon's ready. It can handle the stress of a quick jolt or a cut. And now you're going to just go back in and play. If your hips are weaker, especially for soccer, you're trying to make a cut. Next thing you know, you're rolling your ankles, or you're trying to sprint down the field because somebody's kicking the ball and you're ready to go after it and try to score a goal, and you pop a hamstring. Or you go to make a cut and your hamstrings are weak and your hips are weak, your knee goes in a little bit too much, it's too much of an angle, and you tear your ACL. So these are the things you really have to make sure that when we go back in, whoever is in charge of, whoever the coach is, whoever the strength and conditioning person is for the team should say, hey, listen, guys, before you come back in, I need to reevaluate you. I need to really check you out and see where your deficiencies are, like we were saying before, in the musculoskeletal balance, and say, hey, you are at risk of tearing your ACL because your hamstrings are weak, your hips are weak. And when you go into a specific squat, your knees come together where they shouldn't. All these are little hints, and they reveal themselves a little bit to give you the tips to help you to say, hey, look, let's prevent this from happening. Same thing with rolling your ankle. It all comes from the hips. Unless somebody crashes into your ankle, when your ankle rolls, I say it's never the ankle of foot's fault why it hurts. If it's like you running or it rolls, or unless you step in a hole and your ankle just kind of rolls. But if you're running and your hips and your knees are placing your foot down, if they're placing it down in an awkward position because there's something going on up north in your hips and knees, you're going to feel it at the ankle. So a lot of patients come in here with ankle injuries, and I'm strengthening the hips because I want to prevent that injury from happening again. So to answer your question, my big concern is not having people be ready, their muscles be ready to handle the load of the training regimen, which you need to do because you got to get better. You always push yourself during practice.
Right.
Absolutely.
And that can all be prevented through physical therapy evaluations, correct? Like whether it's soccer or even other sports, if people were to just come and get a simple evaluation of, anything that may be bothering them, that can all be prevented.
Right.
If I'm not wrong.
Right. Yes. Yeah. I mean, when somebody comes in, before, the best thing to do is when your season's about to start, have somebody come in and say, all right, look, I'm going to do an evaluation on you, and really just do a thorough evaluation. And they'll say, look, I'm fine. I don't need it. I'm not hurt. But again, let's reveal those weak links. Let's find out where it's not supposed to be. Hey, look, this muscle's kind of weak. This muscle's kind of tight. Let's fix it. You have 6 weeks to really build muscle where you want it to build, stretch out muscle that you want to stretch out, maybe massage muscle, spasms away. And now you are in a perfect position that when you go and your coach tells you, hey, listen, this is what we're going to do, your body's ready for it. I made a video once that said, let coaches be coaches, physical therapists be physical therapists, because you have a lot of physical therapists trying to do drills for soccer or for football. And they go, oh, I'm sports specific training. That's the biggest BS. Get the body ready. And whether the person wants to ride horses competitively or, shoot baskets or kick a ball, whatever they want to do, their body be ready for it. Let the coach teach them the techniques that they need to get the sport, for them to be better in their sport. Don't try to do sports drills. I mean, some therapists out there will throw a soccer ball somewhere and they'll kick the ball. It's like, what are you doing? Just and let the coach do that. Like, I know, like, they're trying to be all like, oh, let's do drills. You want to do drills where the person cuts back and forth on a little piece of turf just to make sure that their stability is there, their ankle is there, can handle it fine. But to go in there and start doing team drills, that's the coach's job.
Right.
So I actually have a question for you based off of that. So what is your opinion on, like, preseason like physical tests that they do on the athletes? Because I'm pretty sure I haven't done any of that before college season.
No, and if you guys think about it, like the NFL does this where they'll say, oh, NFL ACL count, and they'll just every day when there's preseason going on, they'll just be like another ACL torn or another person tore their ACL. When I listen to like sports radio, when I listen to ESPN or anything like that, I don't give a rat's behind about anybody's stats, about who did what or who did. I don't care. All I listen to is injuries, who's getting injured and why. That's where my focus is on, and it's all the time. You see an ACL tear here and there. It's because these guys are coming in and they're expected to keep themselves healthy, and that's why everybody says, "Oh, can he stay healthy? Can he stay healthy?" You always hear that. To me, it's not the athlete's job to stay healthy. Now, I'm not saying go home, eat, McDonald's, smoke cigarettes, and don't move. That's you got to take some kind of responsibility for yourself. But your physical therapist should say, hey, look, before we're going to start training in about July 1st, let's say, right? I need you to come in mid-May, and I need to check you out, and you need to basically be my patient 3 times a week for the next 6 weeks so I can get you ready. That's no athlete's going to sit there and be like, hey, you know what? I think my hips are a little bit forward, and I think my quad is tight, or I think my hamstring's a little bit more, less flexible than it should. They don't know that, and they should know that. That's where you need a professional to come in and assess them, and to make sure that they find these weak links. All right, let's fix it. And then when you go to play, your injury risk is so low. If you guys look, I know a lot of the injuries that happen, especially in soccer, like people don't realize, like a lot of the concussions that come are from soccer. Mm-hmm. So guys are going up, giving you a header. That's a traumatic injury. You're running and somebody slides into your leg and snaps your ankle. That's a traumatic injury. A lot of other contacts when you hit into somebody or when you these are traumatic. But when you're running and all of a sudden you go to make a cut and your knee just gives out, nobody hit you. There was no trauma. Why did they give out? That's the fault of the rehab specialist. They failed to stop that from happening by strengthening the appropriate muscles, by keeping the appropriate tissues nice and tight to stabilize that joint so that ligament wasn't overstressed and didn't tear. Or if you're running down a sideline and all of a sudden your hamstring goes, that's because your hamstring was too weak to handle that sprint and it popped or strained. So if you would have strengthened that hamstring prior, for 6 weeks or so and got it really ready to handle the load of sprinting, it wouldn't have strained.
Right.
Wow.
Are there any other specific injuries that, if like from soccer or any other sports, that would be prevented if we went and did evaluations before like a player season?
Sure. Let's start with, I know you guys are soccer, but let's quickly do baseball, right? Pitching. All these guys going for Tommy John surgeries. Tommy John surgeries, basically, there's a ligament right here in the middle, on the medial side, inner side of your elbow, called the UCL, ulnar collateral ligament. When you pitch, there's a lot of force placed on this, and it basically snaps. So the reason there's so much force here is lack of rotation at the shoulder. Furthermore, there's more studies that have been done that if your hips are tight, the affected hip on that side is tighter and less has lacking in rotation, places more stress here in the upper torso. Then if your shoulder is now the full rotation, that places more stress on it all just keeps working down until you reach the end of your fingers and it comes out, right? The force just keeps going to the next joint. All the force culminates here, and eventually this ligament just goes. So if you were to have a pitcher come in or a baseball player come in and say, look, let me just simply check out the rotation of your hips and your shoulders, and you can figure this out and say, look, your shoulder's limited by 30 degrees. Let's get that to increase. And your chance of tearing that UCL goes way down. We mentioned in soccer, have the person come in, do some functional activities. You hold their hand, they basically hold your hands. You can feel which one is, and they stand on one leg, and you can see which one they put more pressure on. You have the person do a one-legged squat, two-legged squat, going up on their toes. When they squat, if their knee juts in, it's weak hips. You muscle test them. You say, all right, look, your hamstrings are really, really weak. Your quads are nice and strong, but your hamstrings are really, 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 really weak. So when that happens, your risk of straining the hamstring goes up. Your risk of ACL tears go up. So also with the ankles, you see the hips are weak, and from the femur starts here, right, at the hips, and it juts in. So when you're walking, it looks like your feet are nearly touching when you're walking. Well, you're going to have a higher chance of rolling your ankles. So let's fix the hips. Let's strengthen up. Let's strengthen when we need to strengthen. Let's get the person on some rocker board exercises, one-legged, throwing the ball when they're holding on. It really works their ankle, so the stability of the ankle goes up. There's so many things you can do, and no athlete is ever going to come in and just be perfect with everything. There's always going to be some deficiency, and you just got to fix it. And it's a lot easier to fix it before it happens, because once it happens, now you're a hamstring that you strain, and you have like a nasty strain where the whole thigh turns black and blue. It's a lot harder to come back from that. That tissue is always it'll tear. It won't maybe tear off the bone. Sometimes it does, but it'll tear a little bit. And then when scar tissue bears down, that scar tissue is only 70% as strong as the tissue that was there originally. So you're always a little bit weaker and a little bit more of a chance to strain it in the future. So best thing to do is just stop it before it happens.
Right. And I think there's a lot of players out there who, before they're going into preseason or even just a game, and they're like, oh, you know what? My legs aren't sore. I feel good. I've been running. And they may not know that, like you said, that their muscles are really they're not strong enough. So
Right.
that's why I think if any players were watching this, you should definitely always get an evaluation, because you really never know. Just because you're feeling good one day, another hour later, you could just be out for the season.
Right. It's a great
point.
If you think about it, it's a great investment. Invest
Yeah.
20 minutes, half an hour to come in and really just get assessed. And then we say, oh, no, everything looks good. You know what? And easy, just write down on a piece of paper, listen, strengthen this, strengthen that. This is a little tight, stretch. And then maybe come back in like 3 weeks and let's test it again and see what you did. And if you're a little bit more closer to that musculoskeletal balance. And if you are, then more power to you. And a lot of people, many people are, in great shape. But like I said, when there's a deficiency, it's not like comparing one guy to the next guy. It's comparing your quad to your hamstring, your bicep to your tricep. It's you. And it's your left side to your right side. So all these things is specific to this person. So whether you're stronger than your friends, that's cool, but you got to make sure like you're in balance. And that's what you compare your,
Right.
the opposing muscle and the opposite side of that, left to right side. So
Absolutely.
Definitely.
Ricardo.
So, what do you think would help limit soccer and other sports injuries? Should we wait until athletes get injured to do a thorough evaluation and treatment, or when should this treatment begin?
like I said, we discussed that. I think it should begin before the season starts, several weeks before the season starts, and have people come in, do a thorough evaluation on them, and find out where what needs to be strengthened, what needs to be loosened up in terms of flexibility, and you have at it. And typically in like 4 to 6 weeks, you're going to build the muscle tissue that you need to build, and the person's going to get to where they need to get to. So then when they go to play, again, traumatic things could always happen, but at least the non-traumatic injuries, which if you look at sports injuries, there's so much more non-traumatic compared to traumatic. Like in football, you're going over the middle to catch the ball, some guy crashes into your knee and it bends backwards. That's traumatic. It sucks. You could have trained your whole life and keep yourself in perfect musculoskeletal balance. You're strong where you need to be strong, but hey, the knee's not to be bent backwards.
Right.
When it happens, it happens. But at least your chances of having the non-contact injuries go down.
Yeah. Do you know off the top of your head what percentage of injuries are non-contact, based upon any sport, really?
I think in all sports, I think greater than 60% of them are non-contact.
Absolutely.
60%.
I think I remember a quote actually I had on one of our that nearly 70% of ACL tears are non-contact. There was nobody who was near. I've had soccer players, goalies, where they said, "Look, there was a breakaway. The guy was coming. I took a step to the left, not like he kicked the ball and I took a step to the left to go block it. Literally just took one step to the left, get myself in position to be able to handle what was coming at me, and the knee just buckled. I fell right down. I didn't even know what happened."
Wow.
And you guys see it all the time. I mean, there's Instagram feeds that I follow, ACL tears, ACL recoveries, and you just see people tearing their knee. And many times, again, it's like skiers, it happens to them. But a lot of times you see a soccer player just running, he's going to make a cut and it just goes down. And you're like, you almost think like the sniper got him, he just fell and the knee just gave out because it was going one way and the knee went the other way and it wasn't able to be stabilized. So that's why I just kind of gave out on it.
Do you think, since a lot of towns, even like Long Island, like there's a lot of turf fields, do you think that's a big reason of why knees are very weak in children, not children, like teenagers too?
Well, I like turf for the reason of at least you don't have like grass. You have like little divots,
The hills, yeah.
Bumpy, yeah.
You don't know what you're kind of stepping into. And back in the day, you used to play, and there'd be like a sewer grate, like lots of sewer.
Still got those.
So turf is good when you know what you're on, and it's gotten a lot better. I mean, I'm older than you guys, but when we played at Hofstra when we played football in high school, and it was like the AstroTurf, which was like concrete. I mean,
Yeah.
I don't know the difference between how many more people get injured on turf compared, because I know the turf has gotten so good now. It's like really like just feels like natural grass, and it's you plant a lot better. So sometimes you're going again on it's raining, right? You might slip, but on grass you might just take out a whole chunk of grass, and you just slipping and sliding around. I know turf can handle the stresses a lot better of weather and cleats and everything like that. So it can be a lot better.
Yeah. So, Michael, next question for you is: what do you think about group team workouts, specifically like everyone doing the same weightlifting regimen compared to individualized weight training programs?
I get when everybody wants to get to doing group workouts, right? So let's say we have us 4 here, right? We're on a team. Let's say one of us has severely tight hip flexors and quads. One of us is the opposite. The hip flexors and quads aren't tight, but the hamstrings are very, very tight. The glutes are very, very tight. And all that does is since it attaches to your hips, right between your hips is the sacrum. So the SI joint is the sacroiliac joint, right? So basically whatever happens at your hips is going to affect what happens at the sacrum in the middle. And since your whole spine rests on that sacrum, it's pretty safe to say that whatever happens at your hips is going to affect what happens to your lower back. I've had a ton of people that I've saved from operations. They were told, oh, you have L4 herniations, you have L5 herniations, you have stenosis, all these things that come up on an X-ray and MRI. Meanwhile, all they had was a muscle strain in their hips that caused their hips to be pulled way forward or way back, and it gives them a lot of pain in their lower back. So now let's say one of us, like I said, is very, very tight forward. Their hip flexors and quads are very tight, and then the reverse in someone else. So one of us has very tight hamstrings and glutes. We're going to be doing the same exercises. Well, that exercise that we're doing may be good for you, but not for me. Maybe detrimental for me. The reverse with some other exercise we do. So it's good to do the whole group exercises. All right, guys, let's do, your weight training. But if someone's got a deficiency, you may be feeding into the problem by having them do that, whereas the other person might be benefiting from it. But there's a 50-50 chance that you're hurting some and you're helping the others. And I don't know what that does to people's, injury status when you try to put a team together and half your team is, banged up. You think you're doing the right thing, and you are, but you got to take that extra step and say, all right, look, you come here, let me evaluate you. Look, here's your specific program where you don't do the squats, okay? You got to do deadlifts, or you don't do deadlifts. You got to do squats, whatever it is, or don't work your chest out because your pecs are already way too forward and your shoulders are rolled forward. We got to work out your upper back to get your shoulders back. That's what you need. So whatever it is, you need to dissect it each person at a time and give them their own workout routine. And is it where we're going to say, oh, there's 50 people on a team or 25 people on a team, we're going to have 25 trainers? No. The trainer has to take the time early. And again, it's an investment. Take the time early to evaluate every single person. It might take you a half an hour for each person. I'd rather do that for 2 days and make sure everybody gets exactly what they need and come back in 2 weeks and I'll reevaluate you again. I mean, isn't that a better use of time? And then give that person specific exercise to do. You give an athlete, say, listen, you got to work your hamstrings. They're going to know what to do. You got to point them in the right direction. You got to sit there and count every repetition for them. You say, look, I want you to work your hamstrings. I want you to do this exercise, this one. Don't do this one. Don't do this one. Don't do this one. Then they come back. And then always I describe it when a patient first comes in. You know how a plane is supposed to have its wings on, at the horizon level. When they first come in, they're way to one side because they're off. They're not balanced. So what we do is we start doing massage, stretch, exercise, and you keep doing it. Sometimes they go this way. So now you got to say, okay, let's reevaluate again. And now let's go back towards the other direction. Now they're level. So that's the way they should be doing it. Every couple of weeks, we do an evaluation on someone. It's a lot better than doing the group exercises. And again, some people might be doing it for the benefit, some for the benefit.
Right.
So I have a question actually, because this season for my college team, we were suffering a lot of hamstring injuries, and our PT trainer, I'm pretty sure she was putting the blame on our core strength, and she had us doing sit-ups and leg lifts before every training session as a group, but for like 15 minutes before each training session. What's your opinion on that? Like, what does the core strength have to do with my groin and my hamstrings?
Zero. I mean, it doesn't. Let me explain. I did. It's another video I did on hamstrings because a lot of people are asking about that. It's when you are sprinting, your quadricep is your front thigh muscle, right? It's always a little stronger than your hamstring, which is the back thigh muscle. Now, I'm going to try to explain. Like eccentric contraction versus concentric contraction. I'm going to use my bicep, okay? Let's say I'm holding the dumbbell. From here to here is a concentric. That means the muscle is shortening and it's contracting. But from my lowering it down, it's still contracting, but it's lengthening. It's getting longer as I go down, right? Same thing with the hamstring. When you're sprinting and your leg's behind you and you're ready to bring the leg forward so you can take the next step, the hamstring is eccentrically lowering or allowing that leg to fly forward, catch the dirt, and pull you forward again. So as your leg is coming forward, this is happening to the hamstring. And then it's supposed to hit the ground and thrust your heel into the ground to pull you forward so you can take the next step. The force of the quadricep is so strong to fly that knee forward that if the hamstring wasn't there, your knee would snap the other way and hit you right in the face, right? So the hamstring's job is to eccentrically slow down that extension, that knee going straight to grab the, hit the ground and pull you forward again. If you stood there and I said, all right, listen, guys, you're going to stand there, I'm going to throw you a 50-pound bag of sand. You got to catch it and lower it down. Catch it and lower it down. After like 3-4 times, your bicep's going to say, hey, man, too much weight. I can't lower this thing down. And the muscle either pops to protect you so it doesn't tear off the bone. When I say pop, it means it strains to basically tell you, hey, stop, no more, not enough. I can't take it anymore. It's too much force, too much weight for me to handle and lower down. Same thing with the hamstring. It's too much of the quadricep force bringing that leg forward. It's too much for the hamstring to eccentrically or slow it down or nice and slow allow you to lock out the knee and hit the ground and pull. So what you should be doing is if anybody pops, strains their hamstring, you muscle test that person first. So easy, just sit them at the edge. You grab the back of their, Achilles, and you say, try to bend your knee. And the person will really just say, I have a lot of pain there. What you need to start there is you got to start doing quadricep exercises, front thigh, everything you can to turn that muscle down. The reason we do that is called reciprocal inhibition. If I want to calm this muscle down, when I work out my triceps, my brain says, all right, tricep, contract. At the same time, it sends a signal to my bicep to relax. So if I want that hamstring to relax, I'm going to do a lot of quad stuff. I'm going to massage the hell out of that hamstring. I'm going to stretch it out. And after about a week or two, I have the person sit on the table again and I have a muscle test. They can give me a little bit more force and the pain is not that bad. So we keep going. Eventually you can start adding some hamstring exercises and then the person will be able to strengthen that hamstring. That's what you ultimately want to do. You want to strengthen the hamstring. Early on though, it's so inflamed, don't even think about activating it because the person will just jump off the table in pain. So you got to ease into it, calm it down first, and then rebuild it back up. And then you got to go into, you see those Nordic, I forget what they call Nordic, when the guy's on your knees.
When your knees and your, yeah.
That's like the hardest thing you can do for your hamstring. And you can't do that early on, but eventually you want to do something like that where you strengthen the muscle in its most lengthened position, in its most vulnerable position. And once you can strengthen it that way, then you can get back into sprinting. But the whole core thing has nothing to do. Your abs do not control your hamstring. So hamstring versus squat, basically. And the hamstring's losing. And that's why you sprint.
So now that everyone's been watching this and they know the first thing they're going to do before going into preseason is getting their physical therapy evaluation. So now they're in season and there's a game. So we'll stay on hamstring for now. And they're warming up. What is more beneficial for them, to do a static stretch or more of a dynamic stretch? Should they be sitting down, like holding their toe, or should they be doing, like leg kicks or whatever to warm up?
Great question. I actually met up with a couple of track teams and baseball teams and softball teams to discuss this. When you first want to stretch out, the worst thing you could do is just go right into a static stretch. You never want to go into a static stretch because your muscle's cold. It's not ready for a stretch. So you want to start doing some kind of 50%, nothing crazy, jog in place, back and forth, spend about, good 10, 15 minutes, really just kind of jogging, some high steps, some butt kicks, some side to side, some karaoke, anything just to get your legs nice and loose. Then from there, you want to go into dynamic stretching, which is basically you kind of stand and then you want to, like for hamstring, I call them Frankenstein kicks. You just have your hands out in front of you.
And you just kick your hand.
And you just go, 10, 15 yards. And maybe you take a step and you lunge down and you lean back, stretch out your hip flexors. And then you can take a step, cross your one leg over like how men will cross their legs to sit down. And then you just kind of do a one-legged squat that way. Then switch legs and squat that way. So everything to loosen it up. Go up on your toes like you're doing a jump shot. Stretch out your calves and work out your calves that way.
Mhm.
Then when you're nice, you got a sweat going, like you're really getting into it, but your risk of injury is so low because you're not going 100%, you're going 50%. Then you can go into a nice static stretch. And then now the muscle's nice and loose, it's nice and warm, there's not a lot of blood flow to it, and it's a lot more able to be stretched compared to if you just go right into it cold. That's when you want to do that static stretch, and you want to hold it for a good 30 seconds. It should never be painful, though. You want to be able to hold that position. And again, if it's that you want to go a little bit more, it's a little uncomfortable. If you're doing that when you're nice and warm, it's good because you actually can stretch out the muscle a little bit. But you shouldn't be putting yourself in a position or have somebody push you in a position where now your muscle's getting too tight, and as a protective mechanism, it actually gets tighter. You don't want to do that.
Right.
Good question. That was a good one.
Thank you.
All right.
And because just backing off of that, and I think Ricardo and Rudy can both like agree with me. When we are warming up, almost 90% of teams are, they'll do maybe one lap around the field, or maybe go up and down one more time, and then get straight into a static stretch.
Yeah.
And especially even playing in college, our trainers never really told us that. So I think like we see pros obviously do it the right way. So I just think that, like I said, everyone who's watching this, make sure you're listening to what Dr. Karimi is saying, because these will really benefit you as a player. I can 100% agree with that because I've done both ways, and I really think he's bringing up some great points.
No, especially when you get older and you're going into a higher competitive level. It's different when you're a U12. They don't take it as serious. They all static stretch and you goof around and talk about what you did last night. But once you actually get to the competitive level and you're playing high intensity 90 minutes, you definitely want to take care of your body, especially during the college season when you're playing 2-3 times a week. So, Dr. Karimi's advice is great for all college athletes, high school varsity athletes, and, aspiring professional athletes especially.
Right. And when you're going from, you played, now you're going to halftime, you got to go back. You got to get yourself ready again. Maybe a little less time getting yourself warmed up, but, 10 minutes before you got to start playing, hey, let's start doing the butt kicks again. Let's get yourself nice and warmed up because you don't want to hurt yourself.
Right. What would you do in the event of like getting a cramp? So for like me personally, I've gotten a lot of cramps in like the 75th minute. Maybe I didn't stretch the right way. But if you are cramping up, say in your calf, your hamstring, whatever, you feel it getting tightened, like, the Charlie horse feeling, what do you recommend to do to get rid of that as soon as possible?
Definitely get some fluids in you, get some water in you. A lot of times it's that, you're a little dehydrated, so you cramp up. But you also, when a muscle gets too shortened, it'll go into spasm. So the best thing to do, or a cramp, best thing to do is to just lengthen it. So if it's your calf, you want to like kind of bring your foot out in front of you a little bit, point your toes up towards you and lean forward. If there's something like a wall or the side of the goalpost, you can just put your foot up as high as you can and just lean forward so you stretch out that calf. Hold it for a good 30 seconds. Don't do anything where you're going up on your toes because you're just going to feed into that. So you want to shut that muscle down, especially for the calf. What you could do is you could do heel walks. So instead of like walking on your toes, you walk just on your heels. You keep your toes off the ground. And you just walk maybe like 10, 15 yards that way. Because again, when you're kicking in the front shin muscle, your brain is telling the calf, hey, relax, tone down, and that's what you want. For the hamstrings, best thing you can do is basically just try to jog if you can. And then your legs out in front of you, just kind of lean down, get a good stretch in the hamstring, really, and then you'll feel the muscle like it's tight, it'll fight you, and then it'll just kind of give way, it'll relax for you. And that's, you want to hold that for an extra 10 seconds past that point when you feel like it's giving way. You want to really just kind of hold it. And that's really the best way. So, yeah, fluids, I would get a lot of water in you. Make sure before it happens, if you know that it happens around the 75th minute, somehow several minutes before that, you can just kind of go over, get a swig of water. So this way you got a little bit in you. And, when it happens, at least you know how to take care of it.
Isn't mustard or mayo like a condiment? Isn't mustard or mayo like a condiment that some like
mustard?
Is it mustard that some physical therapists?
That's what I've gotten before.
Oh really?
Yeah, I've seen some trainers whip out mustard and they're just like, yeah, eat it real quick.
I literally had 2 packets of mustard right before I was in the extra time game, and then my last game I played, I was cramping up, and they gave me 2 packets of mustard.
Did it help?
And honestly, yeah, it did help. I was stretching a lot too and drinking water. But
I've never heard of that.
That's awesome.
I heard pickle juice. I heard pickle juice actually helps.
Pickle juice, yeah. No, mustard I never heard of.
Oh wow.
I guess it worked.
He's psychological too, he's just
Yeah.
You're like, oh, I'm
That's
good now.
yeah. get your mind off of it.
Right.
But we
And
talked.
sorry.
We talked
Sorry,
about
go
the
ahead.
pregame warm ups, but the one thing I never understood, and honestly, I just did it because the coach said it, was a cool down. What is the importance of doing a cool down after, let's say, you just played 90 minutes a whole game, of doing a little walkthrough and then back to stretching?
But so when you're playing and you're running around, you're activating muscles and you're tightening. Let's say a lot of running, right? So you're stretching out your hamstrings. Your hamstrings really working. Your hip flexors are really kicking in. You're kicking the ball. Your hips, everything's just very very tight. So then when you just stop, everything's just so tight. You might tighten up. So it's just good to kind of say, hey guys, let's take a step down from the intensity of what we just asked you to do. You were stretched out. You were activated, and you just kind of give that like a give everything like a nice 30-second stretch just to lead into it. Then you can really just do a static stretch because you're already so warmed up. You're sweating. You have
Right.
Yeah.
nice. Then you just kind of lean into it for a good 30 seconds each way, each muscle group, and then you just walk it off. Never just go from a stretch or from play right to sitting down, unless you're just exhausted. You need to lay down. But and I know soccer is. I played it when I was a kid. It's a lot of running, and it's. I give it to you guys, man. It's a lot. I mean, football, you get your 10 seconds of like 5 seconds of a burst, you play and then you're done. Or baseball, I don't know, those guys just really don't sweat at all. But, so if you compare baseball to and there's athleticism and all that, but soccer, you guys are just running. So more importantly, to really just stretch out as much as you can afterwards. But it's not like if you don't stretch, everything's just going to go to hell. It'll be fine, but you might just tighten up. So again,
Right.
invest the 3-4 minutes to just stretch afterwards and walk it off and get a lot of water in you.
Right.
You get a lot of water that comes out of you through sweat, so you want to just replenish that.
Is there such thing as overstretching?
Well, overstretching maybe to if you go to a point where it hurts and you just keep really stretching it, you might be hurting yourself. So 0 is no pain, 10 is severe. I mean, if everybody the simplest thing they taught us in school is like, oh, just have your patient pull back on their finger and they'll feel a stretch, and they should be able to tolerate that position or that kind of feeling. So you maybe take yourself to like a 2 or a 3 out of that 10, like mild discomfort. And that's like the worst of it. You don't even want to go past mild discomfort. And that's if you really want to just stretch it out. But you should be able to hold that position and not be in pain. Everybody says, oh, it hurts here when I stretch. Does it really hurt? No. I feel like a big stretch. That's what they say. So just feel like a nice deep stretch. But you don't want to make the joint unstable either. That muscle tension that, when there's two bones next to each other, that forms a joint, right? And a muscle crosses that, it bridges across. Well, that tendon that attaches to it, it does provide some kind of stability here. So if you really have yourself so stretched out, there's more play in the joint. There's more likelihood of maybe putting more pressure on a ligament or the joint capsule or something like that, where now they're taking too much pressure where the tendon was kind of helping with stability, but you stretch the muscle out so much that you lost that stability. So you could overstretch that way. But if you feel like, wow, my quads are really, really tight, but my hamstrings are not, there's that muscle imbalance again, and you need to get that fixed.
Gotcha.
Right. And how about ice baths and icing your muscles? Is that as important as the cool down and the stretch, or?
Yeah, you've heard a lot of people that physiologically what ice does when you get in, it kind of just decreases overall body inflammation. Cold showers are really, really good for that. Cold showers are also good for when you're with your girl and you're not, and nothing's going to happen. You can take a cold shower. But overall body, just to bring down the inflammation, ice showers and just really not too ice. Cold showers are fine, but it just decreases your inflammation. I've heard that it increases your immune system, your chance of getting sick go down. So ice is really, really good. Heat, not so much. There's 4 properties of inflammation. Whatever area is inflamed will get red, hot, swollen, and painful. So heat is just the reason it gets hot is because there's more blood flow coming to the area. Also, that's the same reason why it gets red. Same reason why it gets swollen. There's just more, inflammation, more of an inflammatory process going on there. Where ice takes away all that. It's the best analgesic, which is pain relief. It's the purest form of anesthesia is ice. You stop the pain response to get to your brain. It takes fluid out of the area. It stops blood flow from coming in. Therefore, of course, it's not going to get hot. It's going to get cold. It's not going to be as swollen, and it's not going to be red hot, swollen, and painful. And the pain, like I said, is going to go down. So, ice is the best thing for anything that's sore.
Right. Absolutely. Yeah, because in college, I know sometimes if we did have a sore muscle, they would have us use like the heat pads before we played.
Mhm.
So I guess
The hot
yeah.
packs don't, in terms of depth, right? So now let's pretend like my thumb is muscle, and
Mhm.
my index finger is skin. The hot pack only goes like this low,
Right.
because you have, you know, your epidermis, which is your skin, then your subdermal tissue, and then your fascia, fat, and then finally beneath that is your muscle. Like when we did dissections in PT school, it wasn't like you just cut the skin, all of a sudden there was muscle. There's a lot of stuff you had to kind of go through. So
Right. Right.
heat is not going to get that low. It's not going to get that deep. Deep is
Mhm.
down here, superficial is up here. So it's never going to it's going to like hang out around here. So a hot pack you'll create a lot more heat by doing the things we were talking about before with the dynamic stretching, the warming
Right.
up. That gets if you put a thermometer in there, that gets the area a lot hotter
Right.
than just putting a hot pack on. It's a waste of time too, because then you're going to have to start moving, and you
Yeah.
have false hope that, oh, I'm loosened up now because I put a hot pack on, but your muscles aren't, and then you strain something. So you might as well,
Right. Right. Yeah.
do the warm up.
Definitely. Right.
It's
That's
a
crazy.
it's a feel good treatment. It feels good, but it doesn't really do much.
Yeah.
Right. Right.
All mental.
Yeah, I can't tell you how many times I got heat packs on for practice, and then
Yeah.
they would ice me up after. Like,
Yeah,
Yeah.
like we have the hydroculator here, and I straight up tell people, I said, listen, I can put heat on it. It's a feel good treatment. That's what I call it. I go, it feels
Right.
nice. Therapeutically, though, it's not doing a whole lot. So but some people are like, you know what, it feels good. Fine, no problem. I'll put it on. But just know that that's not really doing much. But people sometimes have that extra 10, 15 minutes to spare. They're like, I like the hot, whatever you like, but
Right.
you're gonna get to work. So if you're on a time restraint and hey, look, I got to get in here. I don't have much time. The heat's the first thing to go. You're not doing heat. You're doing more
Yeah.
exercise.
Right.
So
And one more. How about stim?
stim is great if you need it. I think about stim is short for stimulation, right?
Right.
So there's a few different types of stim that you can get. One that we mostly use here is called Russian stim, because the Russians used this kind of stim in the Olympics back in the 60s to kind of strengthen their athletes. That's why they just call it Russian.
Uh-huh.
If you just have knee surgery, right, and you have an ACL tear, let's say, and you just had surgery, and now you're coming in for therapy, you could tell the person, hey, listen, flex your quad and tighten up your thigh to kind of wake up that quad. There's so much swelling inside the joint. It's so distended that the quads literally get like a signal to just shut off. So you have to like jumpstart that muscle. When you go to contract the muscle, anything, my hands are moving around right now. Like, you ever see like a baby when he first starts to move, he's like all spastic. He doesn't realize, he goes to grab a cup, he knocks it over.
Yeah.
You have the coordination. Like when you go to lift and use any muscle, it's an electrical event. So your nervous system, your nerves come out of your spine, and it's like a thin little yellow wire, and you have a piece of steak. And that wire just goes right into the piece of steak. That steak is muscle.
Right.
And that nerve will electrocute that muscle to contract. How much of a contraction, how much force, how smooth of a contraction you want, if it's a violent one, that's all based on what the nervous system tells that muscle to do. Nice soft contraction or hard contraction. So when that quad is not being able to activate, you need to kind of jumpstart it, just like you would if somebody's heart wasn't working. You got to clear, put the paddles on. So that's why we use the stim. We put the pads right on the muscle. You find the motor points in the muscle where it can, create force, and you'll see the quad just tighten up. The person's not doing it; they're just watching their quad tighten up on them. But when you put, the stim, the ice, and you can get the swelling out of there by raising their leg up, and they lay for 10 minutes, and you're basically reteaching them how to activate that muscle. Once that muscle is able to contract on its own, do I need to stimulate it? If the person can stimulate it themselves? No.
Right.
You discontinue that, you advance the person to them doing it themselves. You never want to do these treatments for the person when the person can do it themselves.
Right.
Different types of stim as well. There's the pre-modulated, there's the interferential, those are like if the person comes in severe pain. But again, I don't use it that often here because the person is in so much pain because their muscles are so cramped up and such in spasm that why would I put stim pads on it to stimulate it more? I don't want to do that. To relax it. And you could put it on certain levels and it contracts the muscle to not irritate it but to relax it. But the amount of times I use it here, the best thing I use is right here, the thumb.
Right.
I get into the muscle, I relax
the muscle, yeah.
and they feel so much better because that's what the muscle needed. You don't, it's an artificial way to try to take care of the person, and the patient feels like, wow, I got the stim, I got the ultrasound, I got the heat. It's like,
Yeah.
Yeah.
size, you
Right.
you can't take that stuff home with you and do it every single day. Let's
Yeah.
fix what we have to fix, not just try to put a Band-Aid on it with feel-good treatments. You know?
Absolutely.
So I actually have a question regarding this stim. I'm pretty sure it was last year during a game. I got charged badly to the point where I couldn't walk close to my hip, and the next day it lumped up where where the impact was, and I got stim treatment on that. How effective is that regarding impacts to the muscles?
You said you had a Charlie horse, like a contusion?
Yeah.
Yeah.
Exactly.
Now, that could be good because if it's hard for you to contract that muscle on your own and they put the pads on to actually get some contractions going, it's good in a way because it's helping to get the muscle contracted and get fluid out of that area. You have a lot of, did it get black and blue?
Yeah, it definitely did.
Yeah, because what you're doing is you ruptured blood vessels, and that's what a black and blue is, all around the area. And when it feels like a lump, like it's hard, because you have a whole lot of dead blood just sitting there. So the stim is good to kind of contract and get things moving. But whoever was working on you, if they would have just done a deep tissue massage in that area, and sometimes you can't take the thumb, it's too much pressure. But you can get an open palm, just kind of press in there, just help move everything out of that area. Even the black and blues will be out of there. And one of the things, remember when I'm sure you guys never got them, but like when we were younger, if you ever got a hickey, what would they say to do? Take
The ice.
Toothbrush.
What are you doing? There's dead blood sitting there. So when you get the brush and you just work it out, it's dissipating all that and gets rid of the hickey after a while, so you don't get beat by your mother like I did. So, that's the best. So same thing with a big contusion in the quad. You get your hand in there, you really just work it out, and you're getting all that dead tissue out of there, that dead blood cells that are sitting there. Your lymphatic system kind of drains it out of you. Drink a lot of water afterwards. That's why they always tell you after a massage, drink a lot of water so you can get it out of your system. But the stim in that point, that section, that scenario would be good to do. But you would need it after you can contract the muscle and get it moving yourself.
Yeah. Okay. I see.
Right. Yeah.
So, I actually have a question for you. I see that you wrote a book several years ago, How to Choose the Right Physical Therapist. Can you tell us a little bit about that and how you intend to help Americans all around the country, athletes?
I sent this to the APTA, the American Physical Therapy Association. I got tired after a while. I wrote, I think it was published in like 2011. After several years of doing this, and after several years of being in the field, my old mentor and I, working together, and my old partner and I, when we were working, every time a patient would come in, they would say, hey, I went to this other place for like 6 months. And I go, all right, well, raise your arm, because they were going for their shoulder. And they get up to here. And I go, 6 months you've been going, you can't get your arm further than that. And then we do a couple of treatments, and they're getting up to here. And then what we would ask, what were they doing for you? And they'd say, well, they were nice, but they, were they massaging you? No, not really. They just had me, use the pulleys and, just kind of do some exercise on my own. And they, did they stretch you? No, they just showed me some stretching exercise to do. And I mean, it was basically that the person was on their own. So it's like a slap in the face for me as a physical therapist, that I'd actually be apologizing to these people about, sorry you had to go through that. As a PT, I'm sorry you had to go through that. That's not what the field of physical therapy should be. And you get a lot of people out there that are like, oh, PT sucks, doesn't work, because they probably had one of these experiences. And I would say the same thing if I was them. So there's different philosophies of treatment. So after I heard many different stories of, one guy said, they left my mother behind a curtain and they just forgot about her. And then like all the therapists went home, and the receptionist found her at the end of the night. Like the lady was laying there for like an hour and a half.
Oh my God.
No supervision, doing the exercise on her own. You get other ones where you go in and they go, all right, here's your exercises, go do them. And the therapist goes in the back and like puts his feet up and watching TV. It's like, what is going on?
Yeah.
That's ridiculous.
Just quit. Just leave the field if you're going to pull that nonsense. So after I heard so much of that from different people, I just decided, look, let me just write a book about how to choose the right one. Not everybody come to PKL, but how to just choose the right one. These are the things you want to kind of look for, because as patients, we don't know. I mean, if I walk into a doctor's office, I don't know if the guy's doing what he should be doing. He's checking my ears, checking my mouth. I don't know. I'm like, okay, I guess it's part of the protocol.
Right.
But he should be doing something else, or maybe he's not doing something else, or he's doing something that's not really has anything to do with anything. So because we as patients don't know, we expect that the professionals we go to know what they're doing. I mean, you guys go sit down with your accountant and just say, well, what about that C form for? Like, you don't know.
Yeah.
Like, hey, here's all my stuff. If you go talk to a lawyer, you're like, are you going to bring up the case of this? We don't know. We just hope the professionals do what they're supposed to do. So I said, look, let me just create a little guide for people that if you walk into a PT place and there's one little bike from 1976 and there's one machine, a total gym that has like 3-4 exercises, and dumbbells that go up to 7 pounds, maybe that person's not going to strengthen you too much. How much really could they do for you? And they call themselves, physical therapy and personal training. I mean, you're really not going to do much for somebody that comes in. Any one of us goes in there and wants to get stronger. If you don't have the tools to get the person stronger, then you should quit or tell the person, listen, I'm not going to do what's best for you right here. You make a decision.
Right. Yep. Rudy or Ricardo, you guys have any more questions?
No, I'm pretty set. I mean, I think that's all valuable information, and whoever's watching this, absolutely, take these all into account. Take care of your body. Make sure you're getting the right treatment. Make sure you're getting evaluated for sure.
Right.
Yeah, I just have one more. Not many people know that you can start physical therapy and be covered by insurance without a prescription. Can you elaborate the benefits of that?
Right. So excellent. There's a thing called direct access law. It's been around since 2007. A lot of doctors don't want you to know that because 70% of a visit to a doctor, to an orthopedist, is non-surgical. Meaning it's any one of us going and saying that my shoulder hurts or my hip hurts. You're not going to need surgery for it, but in the end, they're going to say go to therapy. Let's take two of you guys, for example, right? What's today, the 10th of June? Mm-hmm. Let's say you both have shoulder pain, and it's about the same. You're banged up the same way. It's not like one guy's rotator cuff tore and the other one just has a strain. You have two rotator cuff strains, right? One of you decides, hey, you know what? There's a direct access law. Let me give a call, and they get me in usually between 24 to 48 hours. You can go and see a physical therapist. You can go for 10 sessions or 30 days, whichever comes first. So by July 10th or the 10th session that you've been to therapy, you need to get a prescription. And that prescription could come from anybody, your nurse practitioner, your PA, your family doctor. It doesn't have to come from an orthopedist. So now you start therapy on the 12th. You come in for 6-7 times. You don't even hit the 10 sessions, and you're done. It's late June, maybe July 3rd or 4th, and you're done. You're liberated from therapy on July 4th, right? So you're good. Right. The other guy goes, okay, I got to call to see a doctor, right? So July 10th, you call, hey, we don't have anything until next week. So now you're going in, it's June 17th. You finally see the doctor. He goes, okay, I'm going to give you an injection into your shoulder. I'm going to give you pain medication. Come back in a couple of weeks. Let me see you. So he gives you the pain medications. You have stomach being upset from the pain medication he's giving you. You're kind of loopy, you're whatever. And now you're going finally back in late June, and you see him again. You go, my shoulder's really banged up now. You've been in pain for the whole month. Then he says, okay, go start physical therapy. So now you're starting physical therapy in July when the other guy was done. And you're worse off than he was because you had an extra month of, aggravating it, really getting inflamed. And you spent so much money on doctor visits, on prescriptions, on co-payments. Now you're starting physical therapy. So instead of 6-7 sessions like the first guy, now you got to go for like 14 sessions. Now you got to go for like a good month and a half, 2 months of rehab just to get that shoulder taken care of. So when the first guy was done, July 3rd or 4th, you're done maybe like mid-August, which just doesn't make any sense. Wow. So unless it's like sticking out of your skin or you're bleeding or something really nasty going on, like you fall down the stairs and your ankle's staring back at you, I'm not going to say go to therapy. Right. But the reason we're graduating with our doctorates now since 2003 is because the last couple of years of our schooling is all differential diagnosis. Meaning if somebody comes in and they have something going on and they say, my chest hurts, my shoulder hurts, it's radiating into my shoulder and down my arm, and I'm sweating profusely, I'm not going to think it's your shoulder. You're probably having a heart attack. So that's the kind of stuff that they teach us in school to know when therapy is indicated and when it's not. And a lot of times when people go see the orthopedist, it's not that you need surgery. It's not that you need any kind of injections. It's just that you need a little bit of therapy. And the faster you get yourself into rehab, the shorter period of time you're there. So the longer you wait, the more you deal with something, the longer you're going to have to, take do therapy to get rid of it.
Yeah. Right. And Dr. Karimi, do you have anything else you'd like to add about your business and your facilities or anything?
To all the guys that are listening, that are playing, whoever wants to come in for a free assessment, please give us a call. Tell us they're from your team and just the supporters of you. They can come in. We'll do a free evaluation, check them out. If anything's bothering them, we can let them know, hey, look, this is what's happening. It's on us. And then, if you need to, come in for therapy, great. If not, if it's just a little bit of advice you need, awesome. So we're in Amityville. We're in Bethpage. Our website is pklpt.com. And if you have any questions, just give us a call. We'll be happy to answer. And again, you don't need a prescription. You can come in and you know something's been nagging you or bothering you, and maybe you tried rehab in the past. Again, you haven't tried it the way we do it. So, you know, we're usually like the last stop when somebody's like about to go for surgery. They come and see us, and a lot of times we just keep them from that operating room. They don't have to go because we figured out what the true source was, which is the biggest takeaway from this. You guys notice everything is muscle. Everything. If the muscle is inflamed, it will stop you in your tracks. It will make you see stars all at the same time. It's a muscle strain can be quite severe. So always, even though when you think, no, this can't be muscle, man, this hurts too much, it's probably muscle. So get it checked out.
Right. If you are a player, do not take this information lightly. This could be the difference between bringing you to the next level, preventing injury, or whatever. I'm telling you. And I highly, highly recommend you all go check out PKO Physical Therapy. We'll have the link to them on our posts and on our YouTube and Instagram. Dr. Karimi, thank you so much for coming on. We really appreciate the knowledge. And make sure you follow them, follow Depor, and thank you very much for watching.
Thank you, boys.
Thank you for coming.
Thank you
Good
for
luck.
coming. Thanks for coming on.
Thank you.